Hello and welcome to this video from the Ruth Lilly Medical Library, where we'll talk about the art and science of crafting clinical questions. After watching this video, you'll be able to describe the value of going through a process to break your information need or knowledge gap into searchable components, to differentiate between background and foreground questions, and to identify the parts of a PICO question. Here is one way to look at the steps of the evidence-based medicine process. You start by assessing your patient and identifying an information need or a gap in your knowledge. You then translate that need into a clinical question, search for information, appraise what you find, and finally apply it to patient care. We'll be focusing on this step in this video. It may seem silly or unwarranted to have an entire step of the evidence-based medicine process devoted to asking questions because we all know how to ask questions, right? But asking a well-structured, specific, and answerable clinical question is harder than you might think. We do this to save time because a little time spent here will save you time as you start searching. You'll find better information because you'll have a specific question addressing what you really want to know. A good clinical question will ultimately help you and your patients because you can find good information which you can more easily apply to patient care. So everyone wants to look smart and cool to their colleagues and attendings, right? So if someone asks you to go find information, if you first come up with a good clinical question, that's really going to help. Also, did we mention it's going to save you time? It's helpful to recognize what type of question you have before you start searching for an answer because certain types of questions are best answered by searching in different places. If you don't know much about a topic, you're usually asking a background question such as, what are the treatment options for smoking cessation? You can find answers to these types of questions in point-of-care tools like Dynamed or UpToDate, in textbooks, or even on Google. If you're familiar with the topic, you're usually asking a foreground question. These tend to be much more specific and are tailored to particular patients or settings. Something like, in older adult men, is a nicotine patch versus quitting cold turkey more effective at ensuring smoking cessation after 1 year? This is where you'll start getting into the original literature by searching in places like PubMed, Embase, or Google Scholar to find articles. You'll usually start with a background question and move to a foreground question. Many of you are probably at least somewhat familiar with creating a PICO-style question. We use this to help us break down our information need into separate components. This can really force you to think about what's important and relevant, which will save you time because you're going to be asking exactly what you want to know. So let's review each component. The P stands for the patient, the problem, or population. The I is the intervention, an exposure, or a prognostic factor depending on the type of question you're asking. The C is the control, or what you're comparing the intervention to. The O is the outcome that you think the intervention might impact. And T stands for time. We put this in parentheses because it's not always relevant to your question. So let's go through a patient scenario to see how this all works. We'll say you've got a patient with bilateral osteoarthritis in her knees who wants to be active but is experiencing pain and doesn't want surgery. You're already somewhat familiar with treatment options, but you're curious about the effectiveness of steroid injections as compared to physical therapy. This sounds like an information need. So let's take this information need and use PICO to break it down into the components that we actually care about. So for the patient and population, this is easy enough. We've got an older woman with bilateral knee osteoarthritis. Identifying what's important in terms of the population is really going to vary depending on your case. So does sex or gender matter in this case? Does age? Maybe we need to know their weight or their activity level. These are all things to think about at this stage. For the intervention, this is usually the new or the novel option, but not always. We'll look specifically at glucocorticoid injections. The comparison or the control is usually the standard of care, or it might be a placebo or nothing at all. It's going to be physical therapy in our case. There are a lot of options for outcomes in this scenario, and in many scenarios, I'm going to say a reduction in pain severity because that's something that we can measure with various pain scales. But it's also important to think about what the patient important outcomes are too, like being able to do the activities that they want to do. Again, time isn't always relevant to your question, but we want to check back in at 6 months, so we are going to go ahead and include it. So part of the reason we have you go through this exercise is to really get at those concepts that are important to you and to your patient. But another reason is that you can use the PICO to craft a beautiful research question. We can do this pretty easily by adding just a few connecting words associated with each of the PICO elements. So for patient, we are going to add among. For intervention, we are going to add do or does. For comparison, we're looking at versus. Outcome is effect, and time is something like during, following, after, etc. And then we fill in the particulars of our case or our scenario with those connecting words to make it look like this. So we've got among women with bilateral knee osteoarthritis, do steroid injections versus physical therapy affect pain severity following 6 months of treatment? It's beautiful. It's a wonderful question. Or you can also use a template to fill in your PICO components depending on different types of questions, from therapy to prognosis to diagnosis and so on. This can be helpful because most PICO questions are intervention or therapy focused, so it can be tricky to use the PICO format to answer other types of questions. So this is a little small, so let's zoom in on just one particular area on therapy, which is what our particular question is looking at. So we could say, again, we could just fill in our PICO components once we've had them identified. So in women with bilateral knee osteoarthritis, what's the effect of steroid injections compared to physical therapy on pain severity within 6 months? So easy. You can find this particular template by going to this tiny URL or by Googling AAACN PICO template, and that will bring it up. I know this can feel like busy work, but the more well-defined your question is, the less time you are going to spend spinning your wheels, and the faster you'll be able to find what you need. So I have 3 main concepts in my search. I have women with bilateral osteoarthritis, I have the concept of steroid injections, and the concept of physical therapy. We can then use that to break those concepts into terms that we might want to search. So again, we've got this concept of bilateral knee osteoarthritis, some additional terms we can use to search are here. Again, we can do that with the steroid injections and physical therapy. We're going to cover how to search effectively using PubMed in another video, but here is how I took the keywords I came up with just now to search on each of my concepts to find relevant information. And a little bit of effort ahead of time can help you find great stuff and save you time in your search. So translating an amorphous information need into an answerable clinical question is a skill, and it will take time to develop. Be patient with yourself. Remember to use PICO to determine what's important and relevant. This will save you time and help you find information that will be useful to you and to your patients. Thank you for taking the time to watch this video, and please reach out to the library if you have any questions.